Welcome to our lecture on cardiomyopathies. I'm Alyaa Kotby, Professor of Pediatrics and Pediatric Cardiology, Pediatric Department, Ain Shams University. Our intended learning outcomes include that by the end of this lecture you will know the types of cardiomyopathies, apply or understand the underlying etiology of cardiomyopathies, recognize the presenting features, use the appropriate investigations, and apply treatment options for various types of cardiomyopathy. What are cardiomyopathies? Cardiomyopathies are diseases of the myocardium associated with cardiac dysfunction. يعني عضلة القلب تعبت، مش عارفة تشتغل كويس. المشكلة في العضلة نفسها، مش في الصمامات, not in the valves but in the muscle itself. The cardiomyopathies represent a diverse group of conditions whose final common pathway is myocardial dysfunction. يعني أسباب كتيرة وفي الآخر تنتهي بأن العضلة مش شغالة كويس. What are the types of the cardiomyopathies? They include dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, unclassified endocardial fibroelastosis is an example. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is a disease of autosomal dominant inheritance. That is to say, an offspring of a parent with an autosomal dominant hypertrophic cardiomyopathy will have a chance of 50% of inheriting this abnormal gene from his parent. So sometimes the parent might have all his children affected, or maybe none if they are lucky. But then again, it doesn't mean that half of the children are affected and half are not. No, every child has got a 50% chance of getting this abnormal gene. And it is of variable penetrance, meaning that not all have the same severity of the disease. Some of them have a severe form, some of them have a milder form of the disease. In this condition, there is left ventricular hypertrophy. The right ventricle might or might not be hypertrophied, and there is an interventricular septal hypertrophy, and maybe it may be obstructive. Hypertrophic cardiomyopathy, obstructive cardiomyopathy, or HOCM, is accompanied by obstruction of the left ventricular outflow, and it is of a more severe condition and presentation. How do these patients present? They might come with dyspnea, paroxysmal nocturnal dyspnea, or chest pain, maybe only chest pain. Sometimes they present with syncope, palpitations, or sudden death. And what is alarming, that sudden death might be the first symptom of hypertrophic cardiomyopathy. You might think that you don't see these patients and this is something written in books. No, you have seen patients of this condition dying or heard of them in patients dying while during their athletic performance or while running. They might be having hypertrophic cardiomyopathy. Ventricular tachycardia and or fibrillation is a common cause of death in these patients. The treatment is by using beta blockers and calcium channel blockers. This is a normal heart. You can see here first the left atrium, that's the right atrium, the interatrial septum in between, and normally there is an echo dropout in this during the contracting heart. Look here, there's an echo dropout. You can see the whole of the interatrial septum. But if you look at the video and an echo live contracting in front of you, the interatrial septum appears in the middle. That's the left ventricle, that's the right ventricle, and that's the interventricular septum. Please note, these are the dimensions of a normal heart. In the next video, you're going to look at the normal heart contracting, because to know the abnormal, you have to look at the normal. In that normal heart, please look at the interventricular septal thickness and the left ventricular wall thickness. The video present in the next slide is that of a hypertrophic cardiomyopathy patient, where you're going to find severe hypertrophy of the interventricular septum and the left ventricle. Again, make the movie let the movie work by pressing on the button under the video. This is an international tragedy in which Mark Vivian Foe of Cameroon is taken off the field during a semi-final Confederations Cup match in June 2003. He died that night with an autopsy later revealing hypertrophic cardiomyopathy. So you see, athletes do die prematurely at younger age because of hypertrophic cardiomyopathy, and we see these patients. This is a national strategy. حاجة عندنا هنا هو حاجة في مصر. وفاة إسلام ناصر لاعب منتخب الدراجات خلال البطولة الإفريقية بجنوب إفريقيا بعد أزمة قلبية. أهو معاه الكاس وكان طالع التاني وكان شايل علم مصر سعيد and he died suddenly. Most probably these patients have arrhythmias second to hypertrophic cardiomyopathy or some sort of conduction defect. So we have to exclude hypertrophic cardiomyopathies in athletes and in those competitive athletes and in families of young ones who die prematurely. يعني أي حد في العيلة بيموت بدري وفاة مفاجأة. You have to investigate the whole family to exclude that there is hypertrophic cardiomyopathy. Dilated cardiomyopathy. Dilated cardiomyopathy is the most common type of cardiomyopathy present, and there is dilatation and impaired contraction of left or both ventricles. It might be idiopathic, that is, we don't know the reason, familial or genetic, viral as viruses like Coxsackie AB or adenoviruses, or autoimmune reaction affecting the myocardium, toxins affect the myocardium, associated with a recognized cardiovascular disease, or multifactorial because sometimes a patient gets a viral infection and he has got a genetic predisposition. What is the clinical picture? This is rather difficult because if you don't know the patient, you will not know if this is secondary to a viral myocarditis or it's an idiopathic cardiomyopathy. The presentation is usually with heart failure, which is often progressive. And frequently they have pneumonias. They present with pneumonia. Why pneumonia? Because patients with heart failure, they have plethoric lungs, congested lung fields. This makes them more susceptible to infection. And they might develop arrhythmias, thromboembolism, or sudden death. That this can occur at any age. On examination, they have signs and symptoms of heart failure, and these are mentioned in the heart failure lecture, and a mitral regurg murmur might be heard at the apex in severe cases, in patients when they have dilated left ventricle, usually the dilated left ventricle, and the mitral ring is dilated. So in these patients, you have to investigate to know whether this patient had a dilated idiopathic or a viral cause for cardiomyopathy. Treatment is with anti-failure measures. In this slide, you can see the long axis parasternal view where we are looking at the heart from the sideways. There is the left ventricle giving the aorta with the aortic valve in between, the left ventricle and the left atrium with the mitral valve in between, and the right ventricle. The next slide, you're going to look at the long axis parasternal view of a patient with cardiomyopathy. The left ventricle is dilated and poorly contracting, but you might not be convinced because that's the first time for you to look at it. In the next slide, I'm going to show you a video of another patient with a dilated left ventricle and a poorly contracting left ventricular wall. You can say also, well, it's not that poorly contracting. So to know that if it's poorly contracting or not, I have put you again the contracting normal heart. Please compare the contraction of the normal heart present in the third slide to that of the poorly contracting heart in the one before. Restrictive cardiomyopathy. It is characterized by poor ventricular compliance and inadequate restrictive ventricular filling with normal and near normal systolic function and wall thickness. Restrictive cardiomyopathy can be idiopathic with no cause or might be secondary to diseases as amyloidosis, which is rare in children, endomyocardial disease, more common, particularly in certain areas as in Africa, with or without hypereosinophilia. There is myocardial fibrosis that is progressive and it is usually fatal. Sometimes it runs in families. Echocardiography is diagnostic in cardiomyopathy, except for the arrhythmogenic right ventricular cardiomyopathy. And please, you can have further readings on this part. So be ready with your questions in the next face-to-face session. And thank you.